Okay. You can mute now.
Deep joined. Deep joined.
So what?
Yes. Please mute, all mute. We'll start within 1 minute. We'll just wait for 1 to 2 minutes more. It's already 9 o'clock. Still, we will wait. So some of our definite members and have not yet joined. So maximum 2 minutes more. We will just wait. Good evening, all. Now we'll start. Today is our 178th weekly webinar. Today is a special day, the International Nurses Day. On this occasion, we have the talk on Florence Nightingale, and our today's moderator, Dr. Sanjay Malik, who is the Vice President of MS Odisha State Committee, is present with us, and our respected speaker also present with us. Our moderator will give the introduction of our speaker. So without any delay, I request to our today's moderator, Dr. Sanjay Malik sir, to start the webinar. Dr. Malik sir, please continue. Sanjay Malik sir, please unmute yourself.
Thank you.
Yes.
Thank you, Dr. Sangram, for giving me this privilege to moderate this prestigious webinar. Today, we'll discuss about the importance of International Nursing Day and the role of Florence Nightingale to establish nursing as a reputed profession. So before starting this program, webinar, I will just like to give some few words about nursing medical service center. As we know, some of others are joined in this webinar. So it is, I think these words should be there. Medical Service Center is a national level socio-medical voluntary organization, which is a non-profitable organization comprising all categories of health workers, doctors, nurses, and paramedical staffs all over the country. Our motto is to establish health as a fundamental right and to observe the days of great pioneers of medical science and the scientists, those who have dedicated their life for the mankind. And we have to continuously try to create a awareness among the people regarding health and the fighting against the anti-people health policy and anti-student health education policy across the country. So, before starting this webinar, I would like to say something about Sister Rituparna Mahapatra, who is the today's speaker. Welcome, madam, to this webinar. And Sister Rituparna Mahapatra is now working as the vice principal of Sister Nivedita Nursing College, Kolkata, is or Kolkata Heart Clinic. So, without delay, I would like to request Madam Sister Rituparna to start this program. Madam, please start.
Yes. Thank you, sir. Good evening to everybody. And thank you, Odisha MSc State Committee, for giving me this opportunity to discuss about this topic. Actually, today is a day that Florence Nightingale Birthday International Nurses Day. This is a very special day to us. When actually we have started our journey in the beginning of the training period, this is the day we used to take the pledge and oath, actually which we are calling as the oath taking ceremony or the oath taking program. Actually, this year, this 12th May, every year it is coming to us. Every year it is coming to the life of the nurses and the people. But I feel, and the nurses community also, we are feeling that this is the day, again, we are committing ourselves to the suffering humanity. Because when we all are taking the oath, that time we have to take the oath. Solemnly, I have placed myself before God and in the presence of this assembly. Actually, this oath being written by the Florence Nightingale, that is near about 860, when St. Thomas Nursing School was established by Florence. Most probably in that period, it was started. And this is a practice throughout the country and also in the world. The nurses, the probationer nurses, the beginner nurses, when they have started their journey in the student period, they are taking the oath. So today is a very special day for us, for the nurses, that again we are reminding ourselves we are committed to the suffering humanity. We are committed to the people of the society. We are committed to the humanity, to serve the humanity with love, care, and the compassion. Actually, Florence Nightingale, such a character that is, we cannot hold her within our hand, but we can really hold her in our heart, in our mind. One of the famous quotation of the Florence Nightingale, we know so many famous quotation Florence Nightingale has been written, but I can mention one important quotation from Florence that is written by the Florence. There is no part of my life upon which I can look back without any pain. Actually, Florence Nightingale has meant it that without struggle, without any pain, without any sacrifice, we cannot really gain any knowledge, any skill. Actually, in our profession, especially in the medical profession for doctors, nurses, paramedics, we need one word is very common to us. That is whether we have skill or not. But Florence, who is the person who first established this thought in the nursing history, for that we have called her the pioneer of modern nursing. That time she told, actually in that time, that 1840, 30, we can say, people used to say nurses no need any type of training, any type of knowledge. They need to do some work with their hand. But Florence is the first person in the world how she established that as an integral and the indispensable part of the medical science is the nursing. So if we really want to do the nursing, if we really want to give the nursing, we need to have certainly the basic knowledge of science. The basic knowledge of science like physical science, anatomy, physiology, sociology, psychology, that all these subjects actually nowadays what we are studying, that time maybe all this is not in this such a way that is not formed, but clearly she mentioned to us that we need to read the physical science, the social science, the psychology of the patient. And we can see those who all are studying, or I hope that member of the medical service center, actually they all are studying all this type of book. That famous book which was published 1859, one of the, we say in our nursing community, that is the classic book in the nursing profession, which was written by the Florence. Notes on Nursing, the famous book, what it is and what it is not. The name of the book itself is a very interesting. Notes on Nursing, what it is and what it is not. And this is the first written form of book which was published for the nurses, and that was written by the Florence. So when we are saying that Florence Nightingale is the pioneer of the modern nursing, because Florence very easily, she had not come to the field of the nursing. Actually, she is from a very affluent and the wealthy family. She is actually from England, but she born at the Florence, the city of the Florence of Italy. In that name of that, her name came the Florence Nightingale. 1820. She died on 13 August 1910. In that long journey that lady has done throughout her life, some work. Each and every time she was with the work and she has done for the mankind. Being a member of the affluent family, especially in that era, that Victorian era, she's supposed to have with the family, she's supposed to got married with such a affluent family. She can easily lead her life in a very good manner. But Florence Nightingale has the second mind within her. Or that every time she used to think that she need to do something. Around her family, the all others family members, they also used to think the women, what they can do. They can only do doing some work, knitting work. They can attend the party. They can do some singing. They can do some ball dance. All that time Victorian era culture. But Florence did not accept in her mind that she can spend her life that way. And that was also influenced by the social culture. She used to observe the poor woman, poor lady. They used to do some tailoring job. All that affluent lady, they used to use that clothes. But they never thought that all that lady, those who are doing that, but they could not afford that type of dress, that type of belongings. But all that simple such a thing, simple incident makes made the Florence Nightingale to think about the crisis. She used to write diary. So there is so many incident in her diary we can see. She used to express, I cannot tolerate this type of life, the misery of the human being, the suffering of the human being, giving us pain. I would like to do something. Actually, whatever I know that Florence used to believe on God. She has religious value. So once upon a time, she remembered that she had heard some of the voice of the God, that she need to do something which can fulfill her life. So with the conflict with the family members, fathers, mother, elder sister, but she managed somehow that she will do something. With the conflict of the family, she became depressed. She could not do any work. She was feeling that my life is worthless. But she is Florence Nightingale. She could not surrender. She did not surrender to the conflict. She did not surrender to the family that she will lead a life, very easy life. So lastly, with her determination, with her love, with her passion for the human being, and with her very urge to do something for the human being, ultimately she was able to go to Germany, Kaiserswerth for the training. That way, it was not the such formal training what nurses supposed to do, and it was not also built at that time that formal education, formal nursing training school, because before previously I mentioned that people used to think nurses they don't need to study anything, and in that society especially nurses don't have any respect. People usually used to think that those who do not have the any family, those who are abandoned, actually those who cannot take the profession of prostitution, such type of thinking, such type of thought, such type of miserable idea about the nurses that time. But in spite of that, Florence Nightingale was standing on her way that she will be doing some work, and that is she will do care for the human being. In that mind, her family also that time, because they are also the follower of this type of thinking, the nurses they don't have any reputation, not even reputation, they don't have any respect in the life, in the society. So how they are so much beloved daughter, they can do nursing. But at last, Florence gone to Kaiserswerth for 3 months training near about that is 1851. She managed to take the some training, and that was enlightened to her. She came back to London. But which way I am expressing in that time, it was not so easy for the Florence. Actually, we know that nursing throughout the last 200 years, if I say, nursing and nurses was actually influenced by the four things of the society. That is first, the political scenario, second, status of the woman, thirdly, the medical science, and fourthly, that is the advancement of the religion society. So in that time, the political scenario also, that Florence was influenced very much by the political refugee of the Geneva, Switzerland, all this place, France. She was very much inspired by them. The political refugee, they all are struggling so much for the freedom of their own country. So all that context also Florence got inspired. Actually, nowadays, when we are studying nursing very easily, but those who are teaching the student, we know we have the syllabus, the beginning of the syllabus. We need to teach the student what is nursing firstly. What do you mean by nurse? Very easily nowadays we are uttering. This is called nursing. But Not only Florence, there is such other pioneer also. Those who have did the nursing, they all have made the nursing in today's way, like Harriet Tubman, Lavinia Lloyd Wright, Agnes Kerr, they all have built out nursing. So when Florence Nightingale started the journey for the Crimea, the Scutari Barrack Hospital, where she became, really she was enlightened throughout the world. She became the, means what to stay in her life only. When she was alive, that time only, people used to make the card, people used to make everything in their life. I mean, she was a dream. She was Sati thing. She was a heroine of the Britain, country Britain. But Florence Nightingale did the, what to say, there's the enormous, the tedious job in the Scutari Barrack work. Actually, Florence French husband was the Sidney Hardback, who was the chargeman of the wire from the British side. When the Turkey and the Russia, they have the war in the Scutari, that time Florence, the Sidney Hardback called the Florence Nightingale to go to the Scutari Barrack Hospital. When she has gone with the 40 nurses, not even they all are little bit training also. Some of them do not know anything. In spite of that, Florence has that much courage to take that 40 nurses and to go to the Scutari Barrack Hospital. And that was really, nowadays, we can't imagine. Just now we have passed out the COVID, year of the COVID. But we can't imagine in that period, 1853-54, that time, that one lady, she doesn't have so much knowledge, so much skill. In spite of that, she has gone to the Scutari Barrack Hospital, and where hundreds and hundreds patients were coming, and they are in a really miserable condition. No such a food, no such a clean things, no clean clothes, no proper food, nothing is there. Completely unhygienic environment. Nowadays, खूब easily, now we are teaching our students, create a therapeutic environment, create a therapeutic place, create such a clean place for the nurses. For the nurses, nowadays, very much, the so much big hospital, so like to say that is like a hotel, but Florence Nightingale in that time, she has started her work. But that was not so easy for the Florence to do the job in the Scutari Barrack Hospital easily, because the higher official, they were deadly against the Florence Nightingale. Florence awaited with her nurse and got the chance. And when really she got the chance, she made it a history. And he herself became a history, and she made the history in the nursing. The Scutari Barrack Hospital, actually, the wounded soldier, we can see in the Florence Nightingale biography, and especially the different letter written by the soldiers from the Scutari Barrack Hospital. One of the soldier has written, she used to take a lantern and she used to go for a ride the 4 miles. She could not go to all the beds, she could not see all the soldiers. But she was such a character, such a personality, and she has created the real love, real compassion, real empathy for the soldiers, those who are coming from the lower middle class and those who are common soldiers. Because Florence Nightingale really felt for the common people. She used to think all the common soldiers are the victims of the higher official. They used to play with the life of the common soldier. They used not to give the proper food, proper dress, with so much cold. They did not even get the proper warm clothing, but warm clothing used to be in all the storeroom. So Florence Nightingale, when she got the charge of the Scutari Barrack Hospital, she broken all the keys. She broken all the keys and she collected the warm clothes, food for the soldiers. So Florence Nightingale also called as the lady with the hammer, not with only the lady with the lantern, lady with the lamp. She also called with the lady with the hammer. Because that time, all of the person, especially the higher officer of the military, they used to think Florence is a very determined. She is not cooperative. She is not maintaining. She is very not obedient. She is not maintaining the higher authority. But the main reason is Florence was determined in her mission. She was very determined in giving the adequate care. She was determined to save the life of the common people, the common soldier. So the soldier who has written one letter to her family that Florence Nightingale used to work in the night time with lantern, and they were so much impressed, so much respectful to the Florence that they used to kiss on the wall where the Florence Nightingale used to go. They used to feel relief. They used to feel love that there is someone, there is somebody who is really thinking for them. When we were teaching our student, but when we got our teaching from our teacher, nursing teacher, beginning we could not understand. Wow, how I can think that my patient is like my relative, like my father, like my mother, like my brother. We could not imagine that time all these things because that was not in a concrete form to us. Not even we did not develop that time the abstract thinking also. But our teacher used to say, our teacher used to taught us that feelings of nurses to the patient is just like a mother. How the mother is feeling for her child is just like that. If should develop with your skill, with your knowledge, that love you should develop for the patient. After that, when we read the history of Florence Nightingale, we have studied Florence Nightingale. When we read that soldier's letter, that they used to say that really we felt that somebody will be taking care of us. We will live, we can go back to our own family. Actually, the essence of nursing is lying whether really you can love, whether you have the passion, you have compassion, whether you are passionate, you develop empathy for the human being. Otherwise, you can't be a nurse. You never be a nurse. With that qualities, human qualities, you need to develop the knowledge and the skill. Knowledge means the scientific knowledge. Whatever we will be doing, whatever we will do in the future, we need to develop that is on the scientific basis. The Florence is the first person who first developed, who tried to develop this concept among the nursing community, among the world, among the nursing science. That's why she was being named that she is the pioneer of modern nursing. Because in the Scutari Barrack Hospital, that nobody used to do the hand washing. That time, Joseph Lister also did not discover the antiseptic theory, the antiseptic surgery. Germ theory, Louis Pasteur discovered in 1861. No concept of germ theory also that time. Blood Florence used to supply all the clean clothes, clean linen. There is so much depth. Florence has written on her own diary that I am such a mother. I left my 70% my son in the battlefield. They all have died because she observed that time that hundred and hundreds soldier has died simply with the unhygienic condition, lack of food, lack of sanitation. They used to stay in the dirty place. Everything, whatever we are eliminating, Within that only, soldier used to stay over there. But Florence and her team, they have started to change the scenario. And lastly, that mortality rate has decreased. And Scutari Barrack Hospital was changed from such a that British time, that London Times, that time they have written that the two heroes from the Scutari, from this battlefield, we can see one is Florence Nightingale, others the common soldier, those who have really, those who have fight for the country. So the beginning of the Florence Nightingale in the Scutari Barrack Hospital taught her a lot. She knows how to develop the hospital, how to develop the sanitation, how to develop the cross ventilation, how to observe a patient. Her famous book, I have mentioned that Notes on Nursing, what it is and what it is not. 1857, Florence first written one book, that is the fact Notes on Hospital, the factors affecting the hospital and the hospital administration. And she was so much detailed. So much details mean each and everything she used to observe, she used to write down, she used to note, she used to draw the diagram. Nowadays, when we are seeing the statistics, the so much diagram as a nursing research also, we are using so much diagram, pair diagram, bar diagram, different type of statistical representation, graphical representation. But in that time, that 19th century, when the statistics, there is no any marking of statistics. That Florence is to represent everything in a document in a graphical representation. For that, she was being called also the pioneer of statistician. And after later in her life, she became the royal member of the Statistical Society also. So Florence made a different note, different observation regarding the hospital reforms. And that time in the London, there is workhouse. Workhouse means that is the keeping all the poor, all the abandoned people, those who have the any food, any facility, those who are suffering from the infectious disease, diarrhea, cholera, all that. Everybody was being kept in that workhouse. Actually, basically, that is a dump house that you don't have value, you don't have any value of your life, so you go to that house, and there is no remedy for that all that poor fellow. So Florence was very much empathetic, and she was very much caring for all that type people. She used to visit workhouse, and after returning from the Scutari Barrack Hospital, she has done a great job for all that workhouse. She reformed. And after that, the Scutari Barrack Hospital, when she became to the London, whole London was waiting for the queen, for the heroine of the Scutari battlefield. But Florence was such a person, she was not eager to publish herself, to magnify herself, to take the very big presentation to announce her own credit. Very silently, very modestly, she gone back her own home to the England, the village place, their house. She has gone back without taking any light of the publicity. And there is a very much the good teaching from her life that doing the work, what actually I wanted to do, my mission, my everything should be done very quietly. Because Florence knew that doing any good job is not so easy, because she had faced a very much conflict from her own family. She felt conflict, she got injury, insult, everything from the higher military officer from the Scutari Barrack Hospital. But with all this, she knew that life is not so easy, and doing the good thing also so easy. So she has quietly returned to her home place. And after that, that historical book she has written, Notes on Nursing, and what it is and what it is not. As a nurse, I am really surprised when I learned the notes on nursing. There is one chapter is there. Everybody can read. Even the people from common fraternity, they don't have to be the medical community person. The one chapter is there, observation. Very nicely, she has given the example that two early morning doctors are giving round. The sister also with the doctor the round. One sister is telling, sir, the patient did not sleep for whole night. Another patient was saying that patient did not sleep for the last night. So the prescription was as per the information, as per the report of the sister, doctor has done some prescription. Torin was telling, but interestingly, if you observe, she has written in her book that one patient could not sleep the last night because of she was having abdominal pain. One patient could not sleep. There is so much sound in the ward. Maybe another patient did not sleep for another reason. But nobody has observed and nobody has mentioned what is the actual cause of the not sleeping the night. Why they could not sleep in the night. One more interesting example. Two patients, sister being told, two patient is having diarrhea. One has taken 5 times the bedpan, but she did not pass the stool very much. One passed stool so much. But from our part, we did not observe the bedpan, whether there is stool or not. Others is diarrhea, that is all right. So simple examples she has put, but she has opened our eyes. That observation is the key point of learning the nursing. Otherwise, we won't be a good nurse. And one of the famous quotation of the Florence Nightingale, she told, if some nurse told, I have learned everything. I am a finished nurse. I am a finished product of the nursing community. She is the most ignorant because she doesn't know. Doing each and everything every day, same work, same thing. Maybe like there is some of the doctors is over there. Maybe we are checking vital sign like temperature, blood pressure. We are checking every day. But there is different because different patient, different problem. We are approaching the patient different. Nowadays, there is too much crisis. Giving time, giving proper communication. In the medical community, we are saying the therapeutic communication. Communication means we take in confidence my patient. We need to explain, we need to get confidence from his or her that I am doing something, some job. When simple work, the vital sign, we are doing the different patient in a morning shift, 6 patient in a different approach we are doing. So whoever is present over here, the nursing that syllabus, the develop, especially general nursing and midwifery, which is usually called by GNM. That syllabus, the tone of the syllabus, the tune of the syllabus actually developed along with the Florence Nightingale thought. The St. Thomas Nursing School, 1860. That St. Thomas Nursing School also built with the money of the Florence Nightingale Fund. After the Crimean War, so much fund came in the Nightingale Fund, Florence Nightingale Fund. With that fund, Florence built up the first school of nursing according to her model, the Nightingale model, the St. Thomas School of Nursing in the London. From there, the nurses used to got training and they used to be trained. And from the training school, St. Thomas Hospital, Florence School, Nursing School, nurses used to go. The different part of the world, they used to go, they used to taught. So Florence Nightingale at the days like 1860, almost 41 years old. Due to Crimean War, she got that time the Crimean fever we know she got. So sometimes she became like handicapped. She could not do anything. She could not write. She could not do anything in her own. But when she became fit, well, she used to write letter to the probationer. Probationer means those who are coming the first from the nursing training. So one of the greatest collection by Florence Nightingale. Letter from Florence Nightingale to her nurses. There she expressed some interesting point. Sometimes due to teaching, we need to study that point, that experience, that is not a single word, that is not a simple word. Experienced, perfection, perfectionist. All that language, all that understanding will come when really you will do the struggle, you will try to learn, you will do something for the people. That time, that perfection, that experience, all that come in your hand, all that come your knowledge. That knowledge will help you to do the work nicely. Actually, the teaching of the nursing, the teacher us every time we are giving emphasis in the 3 points: the cognitive point, the psychomotor point, the affective domain or the cognitive domain, that is the emotional side. Because the learning, when the probationer coming to the school, we need to teach them. That is the syllabus of the Indian Nursing Council. The history of the nursing, that is very short, very little, but student need to know. Second, the important point, the ethical guideline. Ethical guideline means Florence wanted to build up the nurses, not only as a good nurses, she also wanted to do, made us that a really good human being, good woman, good human being. That's why that ethical guideline, ethical principle, nursing ethics, that was built it when you are taking pledge. We are saying, we will not do such a thing. We will refrain ourselves from such a thing that will hamper my professional life, my personal life. Because the sisterhood, this is a very important term. Florence Nightingale refused her love. She did not marriage. She respect one person, but because of nursing, she wanted to do for the suffering humanity. She wanted to do something for the common people. That's why, with the tears also, she refused her love. She did not proceed to her personal life. Nowadays, we are not saying that nurses will not marry, nurses will not do the social life, all that. But as an example, that in that era, that 19th century, that is not 21st century, one lady, and Florence was a very beautiful woman. She was very much excellent in different language, Italian, French, German, Greek. She used to love to singing very much, but she did not take this life. She really devoted. She really devoted her life to the nursing. Nowadays, when we are seeing the nursing in a fourfold manner, to promote health, to prevent illness, to give the to alleviate the suffering, to rehabilitate the human being. That conception of prevention. After Scutari Barrack Hospital, the experience of the Florence Nightingale, that when she told about the prevention of the disease, because she gave too much emphasis, the sanitation theory, the hygiene theory, but nobody could understand. The higher official of the Britain, the higher official of the medical staff, they only understood that lady was saying something is very extra, some revolutionary thought. But what is that? But nowadays we can very easily say the prevention is better than cure. But that time, Florence, the maintaining of sanitation, hand hygiene, providing cleanly dress, providing warm water, giving the clean or the utensil, everything, that was a really revolutionary. Nowadays, we are not giving so much emphasis on that. Maybe we are giving emphasis on that other, so much gadgets, so much technique. But today on the Nurses Day 12th May, we should recognize Florence Nightingale on this era because her famous book, that Notes on Nursing, has been written in the 11 languages throughout the world. The spirit of nursing prepares nurses to think that her patient as an individual, we should respect our patient individuality, we should respect their dignity. Nowadays, all this turn, all this thinking is very easy way to coming to us. But as a nurse, really sometimes I feel like crying. The crisis of the social crisis, the crisis throughout our country, the crisis in the education. Till now, the nursing syllabus, the nursing education is very much enriched. But crisis is that our people, our society, they like to get good nursing, very intelligent, good nursing. But sorry to say, we could not devote the great daughter or great son to the community of nursing. Maybe somebody mediocre, maybe little bit higher than mediocre. We are sending to the nursing. But can we imagine if we close our eye, we can imagine that nurses is not in the world, nurses is not in the hospital, nurses is not in the nursing home, nurses is not in the healthcare facility, nurses is not lending their hand to the really sick, to the sick person, to the suffering humanity. We can't imagine. For that, I am requesting, really I proud myself as a nurse. Surrounding me, those who all are the nurses, the doctor, the members of the medical service center, they all really gave us the teaching, really gave us the light, how to see the nursing, why to respect the pioneer of nursing. Because nowadays, the crisis of the woman, the crisis of the society, also very much, nurses are also being disturbed. Because nursing is just such a thing, it was not came very easily. We did not have any voting right. The nurses, those who have fight for the voting, we got the right of the voting. Especially the Lavinia Lloyd Dobb, one of the great pioneer of the nursing movement, the nursing era. She is from the America. She is from the United States of America. Lavinia Lloyd Dobb, she herself struggled to build up the International Council of Nurses, formally which was being developed, established under 1901. So from that region, beginning of the women's suffrage movement, that time, women liberation movement, nurses also took part in that actively. And ultimately that movement turned up to different movement. And lastly, the nurses got the voting right. So our way, the nurses' way, today's the position of nurses, so much respect. There is a big way, big scope in front of nursing. But what we want to do? What we want to do with the nursing? That is the main question. Whether we'll surrender, whether we will give surrender to the money lending person, because due to privatization, due to commercialization, that due to development of the technology, that hire nurses, they are hiring nurses with so much money. But common people, the suffering common people, they are not getting many times the good nurses, they are going somewhere else. So with the history of the Florence Nightingale, with the struggle of the Florence Nightingale, this is our pledge that we should continue to struggle, to continue to the torch bearer, the history of the torch bearer, those who have handed over the fire on us. We are carrying the fire, the light of the Florence Nightingale, Lavinia Lloyd Dobb, and we should carry their light and we should help the suffering humanity to uphold the banner of medical ethics and uphold the banner of the Florence Nightingale. Otherwise, we can't survive. The humanity cannot be survived without nurses. So as a nurse, again I am paying my respect, paying my tribute to Florence Nightingale. And again, thanks all the members of the Medical Service Center who all are present over here. Thank you.
Thank you, ma'am. Dr. Sanjay Malik, are you there? Okay, thank you, ma'am. Rituparna ma'am, very
Thank you.
nicely. Okay, Sanjay
Thank you.
bhai, yes,
Thank you, madam, for giving a very nice and a long, elaborate discussion on Sister uh, Florence Nightingale and discuss about the importance of the day. And thanks you very much from the Odisha State Medical Service Center Odisha State Committee for an elaborate discussion on Florence Nightingale, the life struggle to establish nursing as a reputed and inseparable profession of medical science. This is possible only because of the empathy and a compassion to the mankind, and that's why Florence Nightingale is a social reformer. And today you united us a long extent. Many aspects of Florence Nightingale we still ignore about. So today you give such discussion beautiful enlightened us. That's why thank you very much. Now I ask the participants if there is any query or anything, any more information need to know, they may ask to ma'am. Is there, Dr. Sangraj, is there any questions or some?
No, no, it is an observational program, so we should conclude it now.
Okay. So now I would like to request Sheikh Khalil to give the vote of thanks. He is from nursing profession, it is a matter. So Sheikh Khalil, please give your vote of thanks.
Thank you, sir. Good evening, all of you, respected ladies and gentlemen. It gives me immense pleasure to give vote of thanks to this August gathering here. My very special thanks to our chief speaker, guest, sister Mahapatra, ma'am, who given excellent talk, a very lucid presentation, and in a very beautiful manner the total life journey of the Florence Nightingale from her child life to later life, and after her the social impact on the society, his observation, his uh, job towards the humanity, the common people. Ma'am, it was very nice presentation. I extend my heartfelt thanks to all the participants, including doctors, nurses, paramedics, health-loving people who are come here and make this webinar successful. I extend my heartfelt thanks to moderator Dr. Sanjay Malik sir, and I also thankful to the committee members of the Medical Service Center Odisha who arrange such type of webinar every weekly, um, and create awareness among the people, among the medical fraternity about the pioneers. And lastly, I am again thankful to our speaker, Sister Rituparna Mahapatra ma'am, for her lucid presentation, and I request ma'am to be with us in future regarding this such type of um, presentation on Florence Nightingale. Thank you, ma'am, once again. And I request to Dr. Malik sir to wind up the program. Thank you.
Oh, now Dr. Sangram, you may conclude the program.
Yes, yes. Yes, now, no, nothing more to tell.